I'd like to lead off with a few excerpts from testimony taken on LD 1487, and these were from May of last year. Maine Equal Justice Partners says, research regarding the fiscal implications of managed care indicates that such initiatives are either cost neutral or could actually end up costing more than traditional fee-for-service programs. Sarah Gagne Holmes continued on, in light of the fact that there aren't significant savings or improved health outcomes for members in managed care, there's no valid reason to disrupt the current initiatives being pursued by the department. And I finish from Sarah. We believe that going down the managed care road at this time may jeopardize continued receipt of the $33 million SIMS grant from the federal government. I'll continue on with Maine Hospital Association's testimony. Local efforts such as those by hospitals and health systems have demonstrated success with local managed care. We should not duplicate efforts and waste precious resources on care management and care coordination if those services are available locally. In fact, to the extent the state has funding for those services, it should be offered to local providers now. And I'll finish off this portion with a testimony from AARP, John Hennessy. AARP believes DHHS is already well positioned to implement payment reform across public and private payers, as evidenced by the Innovation Models Initiative. We believe Maine is moving in the right direction and respectfully ask you to vote ought not to pass on LD 1487 and allow the system to work as it was intended. So, as far as department efforts go, Department of Health and Human Services is currently engaging their own version of managed care to the point where overall increase in department spending has been trimmed to 0.8% for the current year, and the anticipated increase of 1% for the coming 14-15 budget cycle. That's 0.8% and a 1% increase. This is accomplished by moving the system from one that pays for the volume of services into a system that has initiatives for providers for quality of care. Experience has shown that managed care corporations focus on reducing rates to providers, and Maine's reimbursement rates to providers are already some of the lowest in the nation. I was talking to a chiropractor the other day who accepts Maine Care. A $50 back adjustment. Maine Care reimburses $18. It's a 64% reduction in their fees. We have some of the lowest reimbursement rates. You go to managed care, that is the only way managed care can deal with it is through the rates. The department is working with hospitals to reduce the inappropriate use of the emergency department, otherwise known as the ED. This is being done through primary care and case managers at the hospitals, as I said before, locally. These initiatives have saved over $8 million in the state and federal dollars, and with better patient outcomes. The department has health homes which target people with 2 or more chronic conditions, with a goal of reducing inpatient readmissions, less use of the ED, and improved self-management of diabetes and other such chronic conditions. 2/3, or about 200,000 of the Maine Care population will benefit from this program this year. 200,000, 2/3. Let's see, let's do the math. We got about 319,000 people on Maine Care as it is. 200,000 of them being dealt with this year. There are accountable communities in which which is Maine's accountable care effort. This system engages providers in shared savings arrangements, and these organizations will be coordinating the care of all patients who rely on the organization as their point of access to health care services. 6 accountable communities have applied to participate, and these will serve around 50,000 people in the year 2014. This year, 50,000 people. It's fledgling. It's getting started. And then there's plenty of talk about bending the curve when it comes to the main care population, and DHHS has brought down their rate of growth once again to 1% when the national average is 4%. I would say the department's efforts in managed care are paying off. Interjecting a third party into the mix will only add another layer of administration, and we, the main taxpayers, will be paying for an out-of-state corporation to do the work that is currently being performed by the department. Now as to the issue of Medicaid coverage and expansion. I want to start by a quote from a Greek playwright, 500 BC, Aeschylus. I quote, "So in the Libyan fable it is told that once an eagle, stricken with a dart, said when he saw the fashion of the arrow, with our own feathers, not by other hands, we are now smitten." So let's take a trip back in time. The year is 2001. This chamber. The date is June 21st. And the time is just before midnight, the time when all great decisions are made in here. In fact, it was the Senate adjourned the next morning just before 1 a.m. The question before the Senate is LD 1303, an act to increase health care in Maine. And strangely, the bulk of the debate is about the funding method. The amendment on the floor is to raise taxes on cigarettes by 6 cents. And there's also a change in the business tax accounting methods. And only one senator rose to call the body's attention to the fact that the accounting change is a one-time money and the expansion of Medicaid will have unforeseen costs. My senator, the senator from Oxford, Senator Bennett, in his floor speech said, one sentence, "This bill before us will have immense ongoing costs." All you have to do is be around this building since then to know what he said there was true. I believe my predecessor from my town was the watchman on the wall, warning us all of the danger up ahead. Truer words have never been spoken. This bill before us will have immense ongoing costs. And that was 2001, and just a short 3 years later, in 2004, the legislature was appropriating additional money in a supplemental budget to pay off hospital debt. We are going right back into that same trap. We just paid off the hospitals, how much? $700 million or more by a liquor contract. What are we going to do? We're going to wind up not paying our bills. We're going to wind up in the same boat we just bailed ourselves out of. During the debate on LD 1303, members were told that if we take this free money, it was said then, it's said again here, if we take this free money, hospital charity care would be eliminated. I think that was a quote from Speaker Saxel in the other body. History has proven, and hospital budgets have proven, that that is wrong every time. In the words of Dr. Phil, how's that working for you? Once again, we are hearing the mermaids singing their siren song of free money, luring the mariners in this building to destruction on the rocks of fiscal irresponsibility. This federal money is anything but free. In order for the department to administer the influx of nearly 100,000 new enrollees, the Department of Health and Human Services will be required to hire at least 90 new employees to take on the caseload, increasing the size of government by 90 new salaries, benefit packages, and workspaces. And then I bring up January 14th, 2014 letter from the Centers of Medicaid, Medicare Services, CMS. And we learned that there's a portion of the newly enrolled that will not be covered at the 100% for the first 3 years, which, by the way, runs out December 31st, 2016. These are parents from 100 to 133% of federal poverty level. This population will only have a 61.5% reimbursement from Uncle Sam. Free? I don't think so. The main taxpayer will pay the 38.5 cents for every dollar spent to cover those individuals. I disagree with the Office of Fiscal Policy. I'll get to that later on. And given the history, as I said before, you don't have to be in this building very long and watch Maine politics very long to understand that Medicaid expenditures they're overrun with supplemental budgets that annually request more money to prop up a program that demands more money than budgeted year after year. And would any logical mind honestly believe a lowball number provided to us on the fiscal note? This bill before us will have immense ongoing costs. In the Bible, in the book of Proverbs, I quote, there are 3 things that are never satisfied. No, 4 that never say enough. I think in the context of our discussion here today, LD 1487 is a 5th item. And that could be added to the list of things that are never satisfied, and that is Medicaid spending. When we realize the cost of Medicaid, when will we realize the cost of Medicaid is all-consuming? In 1998, Medicaid was a mere 13% of the federal or the general fund budget. Today, Medicaid consumes 25% of the general fund, and you want to grow the program by another 1/3? A few days ago, we sat in this chamber and debated the merits of revenue sharing and finding ways to send money to municipalities. We have bemoaned the fact that we have never met our side of the 55% funding agreement with schools. There's no additional money for the court system, no money to repair the National Guard armories, funds swept from dedicated accounts, inability to adequately fund the circuit breaker program, green crabs devouring shellfish stocks on the coast, and no money for marine resources to study the problem. And did I mention long-term care? Nursing homes in Maine have been underfunded by $100 million over the past 5 years. Why? Previous Medicaid expansion is consuming the money from every department, from agriculture to transportation. And when will this body learn? If you vote for Medicaid expansion in any of its 3 forms that are coming to us, you are voting to dedicate 38% of the general fund being used to fund this behemoth. I will remind you that this is an estimated cost of an additional $800 million above budget after 10 years. The members of this body in the 128th legislature will be debating raising the sales tax to 7% and the income tax to 10% to pay for it. This bill before us will have immense ongoing costs. In just a few short years, we will be like Aeschylus' eagle, looking down at the fashion of the shaft and saying, with our own feathers, and not by other hands, are we now smitten. Thank you, Mr. President.